you for your interest in the Rural Health Clinic program. You have accessed Part 5 of the 5-part session entitled Rural Health Clinic 101. The Rural Health Clinic 101 session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the RHC program, please access Parts 1 through 4 of Rural Health Clinic 101, as well as other focused educational RHC webinars sponsored by the Wisconsin Office of Rural Health. Rural Health Clinic 101, Part 5, Tips on Preparing for the Rural Health Clinic Survey. Compliance with Rural Health Clinic qualifications is determined through an unannounced survey conducted by a state agency or a private deemed organization during the Rural Health Clinic process. So as indicated in Part 4 of our series, once your clinic has received approval of the initial enrollment application from the Medicare intermediary, the clinic has the ability to request the initial RHC survey from the state or one of 2 currently deemed agencies, the compliance team or Quad ASF. However, keep in mind that the clinic does not want to request a survey until it is ready and ensures it meets the requirements for RHC certification. Again, the survey is unannounced, so we want to make sure we're very ready for survey, and we need to indicate that we meet the conditions of participation in the Rural Health Clinic program, and we're ready and have full operational readiness as an RHC. Again, we can black out dates if a survey can't be effectively performed or if we know that a clinic closure is coming up. But again, our survey is a surprise survey. As a reminder, any relevant state regulations will be looked at, NPPA Practice Acts, for example, and any additional accreditation standards that are in addition to the Code of Federal Regulations listed here, 42 CFR 491, the regulations governing RHC conditions of certification. Should accreditation standards that are above and beyond the Code of Federal Regulations be in effect for your accrediting agency, that accrediting agency will let you know about those prior to being on site. Compliance with federal, state, and local laws, location of the clinic, physical plant and environment, organizational structure, staffing and staff responsibilities, provision of services, patient health records, program evaluation, and emergency preparedness are all listed in the federal regulations and will be addressed during a survey. So as a reminder, these are those regulations that govern the RHC program, and the surveyor will want to ensure that the clinic is compliant with the requirements. Note that the first 2 items are usually verified prior to being on site. So those federal, state, and local laws compliance items are already looked at prior to being on site, and the location of the clinic, making sure it's in a rural area and a health professional shortage area or a medically underserved area designation is in fact intact and is current. The next section, physical plant and environment, a large portion of the survey is typically spent ensuring a safe physical plant and environment for patients and employees. Note that the regulations do not specifically spell out each instance with which a surveyor can have an issue. The surveyors do have the latitude to interpret the regulations. For example, it does not specifically indicate that sharps and blades should be secured in the clinic in the regulations. However, most surveyors would have an issue with this if they were not. Another example, lighted exit signs at exit doors are often required by most surveyors, although not specifically indicated in the regulations. The additional regulations should be reviewed as well to ensure compliance. As indicated previously, the accrediting agencies have checklists available for their standards, and the state may have guidance as well that they can provide. And these are the survey checklists and resources available from the accreditation organizations. So again, there's surveyor worksheets from the compliance team that are on their website or can be requested. And standards manual and checklists from the Quad ASF is also available on their website. CMS State 30 or CMS 30 for state surveyors is a checklist that surveyors often use. And the State Operations Manual, Appendix G, can also be put into your search engine. And this is a guidance for surveyors for Rural Health Clinic initial surveys. In addition, you may have a survey checklist that you might want to look at, and this is based off of the CMS 30 that is often used by state surveyors. For example here, under J19, that's the J tag that relates to 491.6 of the regulations concerning physical, plant, and environment. So the regulations indicate the clinic is constructed and arranged and maintained to ensure access to safety and patients and provides adequate space for the provision of direct services. And in the next column, we have some items here that a surveyor may want to see in order to make sure that this requirement is being met. For example, the second line there, exit doors are properly identified. Clinics does not have any exposed building materials, etc. Fire extinguishers are inspected on a monthly basis, and exit routes are free of barriers. Exit signs are properly placed, and exit doors prevent unauthorized access from the outside but allows emergency exit from within. Secondary doors are locked at all times. Shatterproof light bulbs are used in all exposed lights. Again, these items are not specifically in the regulations. However, these are items that a surveyor may want to make sure are in place in order to ensure the physical plant environment is safe for patients and employees. Pre-survey preparation. First, you'll want to identify a survey leader who will ensure that your clinic meets the conditions of participation in the RHC program. Again, you know, it's a team effort, but if you have someone leading the charge, it makes things a lot easier as far as communication to the team. And part of that is preparing a work plan. What things do we need to get done prior to survey to make sure that we're compliant with the regulations and that we can pass survey upon the surveyor's arrival? And part of that is researching and understanding those RHC standards. Again, this checklist and tools available to help you understand the requirements are key, and don't hesitate to reach out to the accrediting agency with questions. Talk with other RHCs in your state who have used the same accreditation organization or have gone through a RHC survey recently. And this is something that maybe you could reach out to the Office of Rural Health regarding. What clinics do they know that have recently gone through survey, and maybe they can connect you to someone at that clinic. And very important here, educate, train providers and staff. Everyone needs to be aware of the upcoming survey and the standards for RHC approval and accreditation. And that's because staff can be interviewed, and it needs to be apparent that everyone is aware of the policies and procedures in place and making sure that they're followed. In addition, of course, we're developing our RHC policies and procedures. There may be sample policies and procedures that you might be able to gain, and we want to make sure that these are specific to your clinic and they really deal with the RHC regulations that are in place governing the RHC program. Conduct a mock survey. So using your best surveyor hat, or perhaps using an outside person to come in to identify issues that others may not have seen that may have been there for years and years. For example, many times we see drawers of expired supplies when it's been indicated that the nursing staff has thoroughly gone through the clinic. So what things can you do if you were to come in from a survey perspective right when you enter your waiting room? What things could a surveyor have an issue with? Get your pad and paper out, make notes of that, and see what items, again, still need to be addressed. Where are we deficient? What things need to be done before the RHC surveyor comes on site? And then, of course, revising and approving your rural health clinic policies and procedures. It's very important that there's evidence that the policies and procedures have been approved and that those responsible for implementing those policies know what's indeed in the policy and procedure manual. On the day of the survey, we want to make sure that there's ready access to compliance documentation for the surveyor. So one, we need to have access to the policy manual, personnel policy files, medical records, maintenance records, and reports. Again, keep in mind that the survey is not scheduled, and perhaps your clinic manager may be off-site at a meeting or maybe even out for the day. So who is there that can get these items for a surveyor? Is everyone aware of the location of the policy and procedure manual, whether it's in print or online? Is someone able to get that for the RHC surveyor? If personnel files are not on site, can they be easily gained for the surveyor? Does everyone know who to contact for those items? The surveyor may have a list of medical records he or she wants pulled. Can someone access these files easily and get them to the surveyor quickly? Proof of maintenance for patient equipment may be requested and often is. Where is this documentation? And again, who can get it quickly? Other reports, fire drill documentation, emergency preparedness documents, etc. Who has access to these? Can we get these for the surveyor in the case that the clinic manager is not at the clinic? And the day of the survey. Make it easy for your surveyor to work. Designate a space for the surveyor. They want to look over your policy and procedure manual. Identify a lead person to assist surveyors and prepare for non-compliance discoveries. Remember that the surveyor wants you to succeed as well, and make it easy for them to do their work, including, again, giving them space to work. And who will be responsible for any deficiencies or notes or a plan of correction request? Surveyors will indicate a specific due date for the plan of correction request, if any, and this is a date that you will not want to miss. In addition, the sooner that plan of correction is approved, the sooner that the clinic is certified as an RHC. So let's say a surveyor comes on site on August 1st. If you pass the survey that date, that's the date the CMS will indicate your RHC certification is intact. If you don't pass that date and you have a plan of correction that is requested, then that is the date that is used, the date that the plan of correction is accepted by the accrediting agency and approved by the accrediting agency. That's the date of your RHC certification. So the sooner that you get that in and accepted by the accrediting agency or the state, the sooner that you'll be certified as a rural health clinic. And in the end, celebrate your success. You and your team have gone through a lot of hard work to get to this point. Your clinic is ensuring access to patients, and your efforts will provide greater reimbursement to the clinic. Congratulations. Thank you again for your interest in the Rural Health Clinic program. You have participated in Part 5 of the 5-part session entitled Rural Health Clinic 101. For additional information about the RHC program, please access Parts 1 through 4 of Rural Health Clinic 101, as well as other focused educational RHC webinars sponsored by the Wisconsin Office of Rural Health.